I can see it. I can see you releasing yourself. Males tend to have a developed underside of their chest a lot more than they do their upper. Hi. Before we begin this video, I'd like to thank all my current Patreon members for their continued support. If you're looking for any other content that I create on other platforms, check the link below. Now, let's get into the video. Hello. You're here for the wet oil massage. Is that correct? You're here to relax and make yourself feel incredible. Is that right? Good. You've come to the right place. I'll be starting this wet oil massage by just starting with some rubs along the shoulders to relax you, to make you just feel a little bit better before we dive deep into this massage. Are there any areas that you'd like me to apply the oil to directly to massage to make you feel better? This is a massage for you. I'm here as the masseuse to make you feel incredible. My only way of doing that is by giving your body the ability on these shoulders of yours to feel clean, to feel rejuvenated and relaxed. Shall we get into it? Excellent. I've got the perfect solution to help make you feel incredible. You're all right if I use the deluxe oil, is that right? Good. Let's take that cap off. There we go. It's a little child-proof, actually. Smart. There we are. Now, shall we just apply some to my hands and then really get this session underway? Let's start. That should do it. A nice, healthy amount of oil to massage you. Now, let's start on your shoulder, specifically this one. Just tell me how it feels. Tell me if I'm hitting the right spots. Don't worry, I won't leave out. I won't leave out this shoulder. And I do apologize if I itch my nose with my arm. The oil is specifically for you. Just relax as I slowly have the oil seep into your skin. Just relax yourself for me. Just take a deep breath in. This is your time to relax. Let's work on this shoulder a little bit, shall we? shoulders are quite tight. I always like to make sure that my clients feel their best. Perfect. Are you feeling better? Are you feeling more relaxed? More oil? I was just thinking the same thing. Just let it drip into your hands. There we go. Much better. How do you feel? I don't need to talk as much to make you feel incredible, don't I? Just relax as you feel the muscles tension ease away. Just be one with yourself. Are there any specific areas that you're looking to make feel more relaxed? Any areas that are holding an absurd amount of tension, that are looking to feel that incredible release, that fury of tension literally come off of their body? Just relax for me. You're doing an amazing job. Let me work on those shoulders again. You seem to be holding a lot of tension there. That's right. Just let the tension ease off of you. Just, I can see it. I can see you releasing yourself, letting that tension slowly but nicely come off your body. How's the oil? Is it nice and warm? That's good. That's good. Just close your eyes. Just breathe deep, slow breaths and let yourself be in the moment. Just be here with me. your body reacting in the way it needs to, letting out all of the tension that it has built up in one foul swoop. Just breathe for me. Deep breath in. Don't think about anything else other than this moment. Just be with me. Be with your body. Be with your sensations that you're feeling. Don't get distracted. Let it happen. Let that tension go. Just let it go. Let yourself release the tension built. Don't hide it. Don't hide that tension. Just let it happen. Just let it flow out of you. Feel it. Let it go. Let that built up tension release. There's no need to hold it back any longer. Just let it go. Let it go. Just let it go. Let go of that tension. Think of nothing else in this moment. In 10 seconds, I'm going to tell you to release all your tension. Your muscles will thank you. Your mind will be at ease. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let it go. Let it all go. Feel those muscles relax. Your eyes, your ears, your mouth, your nose. Everything is at ease. I hope you've enjoyed your wet massage today. The oil of the gods has been bestowed and put along your body, and you shall feel incredible. Hi. You're here for that personal attention, aren't you? Just some good old personal attention. Well, you've come to the right spot. It's my job to give you all the personal attention that you solely deserve. I'll be going through a variety of different techniques simple thing. Simple yet satisfying. Its objective and goal is to make you feel exceptionally relaxed with subtle movements. Sometimes we can get even closer with the more harder end to just let you know you are here and present. Little tiny pinpricks. How does that feel? Take a deep breath like I did. Let it out. Just let it out. Back to the brush. Slow, subtle movements. It's the little things that make a big difference. I've got other items here that I would love to test out on you. They may look simple, but they can feel incredible. Just close your eyes and feel the bristles on your face. Do you feel them? How do they feel? The subtle noise of bristles, the ambiance of people outside. What better things could you ask for? Just relax. I keep saying to relax because it actually causes you to relax that little bit more each time I tell you to relax. Let's get a little closer. Close your eyes for me. What can be more relaxing than some personal attention? Kids playing in the park. Nothing better. Listen to that on your face. Do you hear it? Can you feel it? Let's make you feel even better with some foam. Sometimes just that little. Can you feel it? Can you feel it on your skin? Just relax. Let it calm you. Deep breath in like I just did. And let it out. Just let it out. Let's wipe your stress away. Wiping it away. Wipe. How do you feel with that? As we wipe it away. Wipe. You should be feeling exceptionally relaxed at this moment. A couple more items to go. Some favorite ones coming up. A simple click of a light. Just follow the light. Don't think about anything else except the click. Listen for it. Listen for it. Listen for it. Let's amplify it. Let's make it even more amplified. Click, 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 click. Stay with me now. Click, 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 Let that air out. Deep breath in. Let it out through the nose. A final one coming up here. The subtleness of water dripping down your face. Just listen. Don't speak. Look into my eyes and just listen to the noises of the water slowly embracing you. Don't think. Just react. session with me. I long to make you feel good. Hi. How are you doing? Do you know where you are? That's right, you're in the hospital. No, don't worry. You'll be okay. I'm your doctor. I'm going to be going over a full body exam for you today, just to make sure that everything's good after the procedure that we had done. You did have a procedure done, that's right. But don't worry, it's okay. You're going to be okay. Like I said, I'll be your doctor, and I'm just going to do a variety of tests for you today. Go over a full body exam, test some reflexes, and just make sure that everything is good after that surgery. Okay? Okay, you don't worry. Relax. You can relax. Like I said, everything will be okay. Just gonna be putting these gloves on. Do you know where you are now? Good. Do you know which hospital you're in? Good. Do you know your name? You do? Perfect. So, let's get into this exam. First things first, I'm going to do a variety of cognitive tests on you. I'm going to be shining a light into your eyes, and I'd like you to just look straight ahead, just over there to your bathroom, okay? Perfect. So just look into the light. I'm just looking at your pupils to see how, you know what? I feel like that light might just be a little too bright. Let's use the littler one. So just look into that light there for me. Perfect. Good. Just gonna lean over you there a bit. Just look into the light again. Keep looking. You got a little nasty little scrape on your noggin there. Was that there before? You don't know. That's okay. Let me just have a look. Yeah. The nurses did a good job with that. So just look at the light and look away. Look at the light and look away. Look at the light and take it away. Good. Any issues with that at all? Good. Just gonna feel along your neck here. Just need to look for any bumps, see if there's anything that may have caused this initial reaction to have the surgery happen. No bumps. That's a good thing. Can you just open your mouth for me and just say, ah, for me? Keep your mouth open. Keep saying, ah, really far. Ah, like that for me. Good. Can you move your tongue to the left? Just to the left there. I'll help you. Thank you. To the other side. Good. Can you stick your tongue out one more time and wiggle your tongue? Good. Good. No issues there with your eyes. That's reassuring. No, sorry. Bad joke. You can see me, that's good. What color is my shirt? Blue. Excellent. I'm just going to listen to your heart now. Try and be as normal as you can, just normal breathing. That's good. you always had that? No, I'm just kidding. Your heart sounds completely fine. I'd like for you to take some deep breaths for me now. I'll do it with you. Ready? Deep breath in. And hold. Slowly let that breath out. Good. And deep breath in. Hold. And let it out. Deep breath in. Hold. And let it out. Deep breath in. Hold. And let it out. Good. So, your heart sounds fine. It's a good thing. Your lungs also sound quite healthy. So far, you're scoring good on this test. I'll be looking at your eyes one more time. I just need to test your depth perception, but first, just write some information down here. Patient is responding well to post-op surgery. Sorry, I'm not meaning to rest on you there. You don't mind if I... Oh, sorry. Losing all my tools. Okay. Patient. I'm just mumbling, sorry. It helps me write and remember the things that I was saying. Okay. Perfect. Now, like I said, I'm just going to come to your eyes here, and I'd like for you to just close one eye for me. Good. Can you still see me? Am I blurry? Okay, that's not really a good thing, but close that eye there. Can you still see me? Good. Am I blurry? It could just be the post-anesthesia, the anesthetic wearing off. Now, if I have that there, close that eye again. And if I move it back, can you see me? Am I still blurry? I am. Is this tool quite clear to you? That's good, that's good. It means it is coming back. Let's try that again. Can you see me? Good. Am I clear? No, just a little blurry still. Okay, that's okay. And the tool? The tool is clear. Okay. That's okay. It means that your vision's coming back. Now, I think I'm just going to get a Q-tip here. I'm going to deal with that little piece on the top of your scalp there. Just not too happy with the nurses with what they did there. Sorry, didn't mean to bump you. There we go. Clean that up nicely. All right. Ready for some more vision tests here? Yeah, the reason we test the vision is for the high acuity of vision loss based on the procedure that you had. Nothing to be alarmed about. It's a 1% chance that this happens. You're right, that's 1 in 100 people. I'm just kidding. The odds are much better than that. But I'd just like you to tell me, could you tell me what color is this? This one right here. Good, and this one? Good. Say both colors at the same time. Simultaneously, this one and then this one. Good, and then say it the other way as well. Good. What color is this? Good, good. And this? No, it's not yellow again. This is green. And this. Dark blue, good. Could you name these two colors for me? Say them again for me. Either one. So blue, yellow, or blue, green, whichever. Good. Any issues with any of that? None? Excellent. Oh, your monitor is just, let's adjust that for you. There you go. It was just a little, it was slipping off the side there, and I didn't want it to fall on the ground. So, again, one more time, just tell me that color. Tell me that color. Good. Tell me that color. Good. And this one. Excellent. And this one. And the last one. Perfect. I'm very impressed with your vision. Very happy about that. You're doing well. You're doing well. Patient vision acuity, 10 out of 10. Ophthalmology not required for patient. Temporal acute vision loss, slowly regaining. Orbital intact, retina clear and clean. Perfect. Oh, that piece is just, that wound on your forehead is just not doing too good. There we go. Don't think I'll need that again. Okay. All right, just bear with me for a second here. Okay, sorry about that. The monitors were just being stubborn. I didn't want the cables to go. Anyways, I won't get into details about that. Now, I'd like to test your hearing quickly. Can you just tell me how many clicks you hear? And good. So was that 2 or 1? And again? How many clicks did you hear that time? 4, good. And this time? How many are you hearing now? Good. And now? Good. When I go up to this ear, how many did you hear? Good. And when I go up to this ear, how many did you hear? Good. Excellent. All right. Just need to, once we're all done this, I'll do a quick exam of your body. I'm just going to measure that gash. Okay, good. Nothing to worry about there. I'm just going to listen to your heart one more time. Good. 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 I'm just going to feel your stomach quickly. I'm just going to listen to it. Just going to slowly push down on your stomach there. Good. You can breathe normally, don't worry. Good. 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 I'd like to test your sense of smell quickly. Just make sure that it's come back. This is tea tree oil, so just have a sniff for me. Go ahead, sniff. Quite intense, isn't it? Yes. Good. And what does it smell to you? What does that remind you of, the tea tree oil? Forest. Green. Good. That's all I needed to know. I just need to make sure that you could place your sense of smell. Now, before I move on, I'm just one last little dab on that spot. There we go. All cleaned up. Now, just going to do an exam on your body now. Just a medical exam. I'm just going to feel over you and make sure that everything's good. You tell me if you can feel stuff, okay? Good. So, on your arms here, can you feel as I squeeze your arms? Good. And the other side, can you feel both arms being squeezed? Good. Which arm am I touching right now? Close your eyes. Good. And which arm now? Good. Just going to feel through your stomach. Just going to feel up into your liver area here. Deep breath for me, please. Good, good. Just going to do some... Can you say 99 for me? And again. And again. One more time. And one more time. Good. Just going to listen for any hollow spaces in your stomach here. Good. Now, just going to quickly just push down. Tell me if there's any sections here that are a little sore, okay? Good. Just going to make my way down your leg, okay? I'm going to push on both your hips at the same time. Any discomfort in there? No? Good. And if I push on your leg there, any discomfort there? Good. Good. All right. I'm just going to push down your legs, okay? You just tell me if it's discomforting at all, okay? Can you feel when I touch your toes? And what about this foot? Good. And this leg? As I go up? Good. All right. Good, good, good. Now, I'm just going to make sure that everything is good. All right. How are you feeling? It's been a long day, I know. But I can thankfully tell you that as your doctor, you're healthy, you're fit, and I think I may be able to discharge you tomorrow, but I'm going to keep you here for one more night, just in case. Good? Awesome. I'll come back in a few more hours and do a final assessment on you before I let the nurse sign off so that you can go home first thing tomorrow morning. Okay. Eat the dinner that they give you. I know it's not the best hospital food, but it's for your good health. Trust me. We have dietitians that work to make sure that you have the proper diet based on your symptoms. I'll see you in a few hours. Bye. Hi. Welcome to a session where we'll be going over the male anatomy today. I'll be your host, and I'll be your body that we'll be using as an example of specific muscle groups, dieting, how to change your outlook on fitness, and just your overall health. But to get into that, we need to have the shirt off. So let's start with that. Perfect. So, as you can see, we have a male body to start with. That's me. We've got a chest. We've got shoulders, which I'm assuming you all have as well. Biceps, triceps, lats, traps, and a back. So, what I'm going to be going over today, and before I get a little deep into this, you may notice potential bruising on my arm from here to here, and then also here. No, I haven't hurt myself or anything. I was just in the hospital where I had to get some CTs, scans on my head and neck, lumbar punctures, blood patches, a whole variety of things for some headaches that I've been having when I'm working out. They are potential causes for alarm, but that will be for a separate video that I talk about that. So, this video is about male anatomy. Your chest. Let's start there, okay? So, everybody has a chest, both male and female. Males tend to have a developed underside of their chest a lot more than they do their upper. You'll see that even myself, and I work my upper chest quite a bit. It's lacking up here. Not a lot, but it's lacking. That's not to say that you may not have an upper chest, but men typically have a lower, more developed chest, and then they have a higher chest that's underdeveloped. Up here is your pec minor, and then you've got your pec major on the lower part. Contrary to belief, whether people know this or not, chest muscles, including your triceps, are pushing muscles. And what do I mean by that? Essentially, if you've ever heard of a push-pull leg split at the gym, push day, pull day, self-explanatory, leg day. So how do these work? The chest and triceps can physically only push. There's no way to pull something with your chest and your tricep. When you're pulling something with your bicep, your tricep is loose. When you're pushing something, your bicep is loose, your tricep is tight. They work opposite of each other. So, easy ways to look at that is, how do you know if you have a tricep? Everybody has one. Where is it? As you get leaner, your tricep is about 2/3 the size of your bicep. So if you're ever looking to develop bigger arms, train your triceps as well as train your biceps, but your triceps fill up majority of your arm. Now, for myself, I've been on a diet for 4 weeks now, so I'm starting to see a little bit more definition in areas of my body that there weren't beforehand. What do I mean by that? Prior to these 4 weeks ago, chest definition, this line that you see in the center, was not as apparent. The sides here, how they start to just connect up a little bit into your armpit area, not as visible. Dieting is a huge way to increase overall body sculpture. Contrary to belief, calories in versus calories out is the most basic way of explaining a diet. If you need 2,000 calories to maintain your weight, and you eat 2,100 a day, you will gain weight over a year. How much weight? Well, 1 pound is the equivalent to 3,500 calories. So, if you ate just 100 calories, this isn't a perfect world on paper, by the way. If you had 2,000 calories as your basic metabolic rate, that's just the fancy words of saying how many calories you need to be alive to not gain or lose weight just to be alive. If it was 2,000 and you ate 2,100 in 35 days, you ate 2,100 calories every day, you would physically gain 1 pound of pure fat. Extrapolate that throughout the year, 100 calories a day can add up to 15 pounds or so. Pretty crazy when you do it like that. So be mindful of what you eat. That doesn't mean you can have to starve yourself always, but have fun. 80-20. 80% of the time, 80% of the time, stick to whole foods, whatever those may be, whatever you enjoy. The other 20% of the week, enjoy a food that you like for 1 meal, maybe 2. If you eat 5 meals a day, times that by 7, that's 35. Take the 20% of 35, that's how many meals you can enjoy. And when I say enjoy it, that doesn't mean eat a whole pizza. It means have 2-3 slices of a pizza, or enjoy that ice cream cone. Don't go overboard because you'll negate your entire week's calorie deficit. What I mean by deficit, 2,000 calories again. If you did a 500 calorie deficit daily over the period of a week, that would equate, you're catching on, to 3,500 calories, which is the equivalent to 1 pound. So a 500 calorie deficit over your basic metabolic rate, whatever that number may be, you can go find that online. If you minus 500 calories from that every day for a week, that's 3,500 calories, and that's 1 pound of pure fat that you could lose off your body. Enough about that for now. Let's get back to the male anatomy. So we've got the biceps, one on your left, one on your right arm. The purpose of them is to pull something. By when you pull something, you're engaging your bicep, pulling, and then your back is following through. Your back completes it. The bicep just pulls it towards you, but your back is really acting as the anchor here, pulling as far as it can until the contraction has completed, and whatever it is close to you, or you need to pull it again. Does that make sense? Good. I'm glad it makes sense. Now, I'm just looking at my microphone there because I've already filmed this video once actually, but lo and behold, no audio was picked up on the entire clip, the 20 minutes that I did. So this is round 2, so I'm having to regurgitate what I've said, and I'm trying to keep it informative on what I had previously said. So, biceps. As you lose weight, do you see this line right here? This line will become more and more apparent as I continue to lose body weight. Ideally, I'd like to lose fat as opposed to muscle. Muscle is hard earned and takes a while to build. Fat, on the other hand, you can afford to lose it, or you can gain it, but it's easier to get rid of. But as I was saying, it becomes more and more apparent, that line. When you have a tattoo, though, the one thing I'll say, it looks great, obviously, when you can see what it is and everything, but it gets rid of definition. What do I mean by that? Definition. You can see definition on the arm, the forearm, the bicep, the tricep. See it? Same thing here. It gets rid of it. So be cognizant. If you do get a tattoo, be wary of where it is, and if you like to show off your arms, maybe just do one arm so that you can see the other one and all the hard work you've put in. Now, the chest. Push. The back. Pull. The traps are what you use to squeeze and pull something up. Holding a briefcase, for example. If you had a 20-pound briefcase with multiple things in it, you walk to work every day. Same hand. Over time, that trap, this whole side of your arm, would become more developed than your other. When you're working out, make sure that you take care of both sides of your body. Because if you don't, you will start to see a asymmetrical point where your chest may be overdeveloped on your right side compared to your left, or your left to your right. Your bicep might be a whole inch bigger than your left bicep. I got my lefts and rights mixed up, but you know what I mean there. The same thing goes for your back. Take care of your back. Make sure that it's taken care of. I really mean that. Your lower back. Take care of your lower back. When you're bending over, bend with your knees. You know what they say at work, you always bend with your knees, not with your back. Now, let's go a little bit more deeper into this. As you lose weight, unfortunately, as much as we'd all like to say, that weight does not just come off your stomach. Think about it. If everybody had a six-pack, if that was where they chose to lose their weight, but they didn't do anywhere else, it would look very different on a body, right? Exactly. So, your body decides to lose weight percentage-wise over the entirety of it. It might choose a little bit here. It might choose a little bit here, 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 all at the same time. There's no such thing as spot reduction of fat on your body. That just sounds weird. You can't tell your body to just lose forearm fat or chest fat or stomach fat. As a whole homeostasis, your body will lose weight from head to toe, toe to head, at an appropriate rate combined. However, the one caveat is you may notice most people, probably because they have clothes on, show it in their face the most. When you start to lose weight, you will see your jawline becomes more and more apparent. Most people hold fat in their face. That's why we mostly have round faces, because of our consumerism habits of what we choose to eat. But when you start to lose weight, your body will shed it naturally all over. But your face will show it first, because most people have a shirt on, unless you just hang out all the time without a shirt or clothes on in general. That's your interesting fact. Take care of yourself when you're eating, though. Whole foods. I'm not going to go into what whole foods are. Just search it up yourself. Whole foods, and make sure you're hydrating. Water, water, water. 70% of your body is made of water. So you'd think water would be an important factor to keep up with. And if you are on a diet, make sure that when you're dieting, you consume 0.8 to 0.1 gram of protein per pound of body weight. So if you weigh 200 pounds, ideally if you could eat up to or near 200 grams of protein in a day, it gives your body the chance to use those proteins to keep muscle tissue. Protein is what helps synthesize and build muscle proteins while losing fat, retaining muscle all over that you've worked hard for. If you don't consume enough protein in a day while you're dieting, your body will start to cannibalize itself. What do I mean by that? It will start to use its own muscle tissues to fuel the body. Now, I know that sounds a little scary, but don't worry. Just maintain your protein, hydrate, and don't do too steep of a calorie deficit. If your body needs 2,500 calories a day just to be alive, you have to factor in, do you work out during that time? Do you have an active job? Do you have a sedentary job? Maybe you're closer to a full 3,000 calories a day because your body needs 2,500 to be alive, but throughout the day you're actually burning 500 calories. So maybe just take 2,500, bring it down to 2,250 for the day as a deficit. Try that for a week. Did you lose any weight? Yes? Keep that same calorie deficit again into the next week. Did you lose any weight? Yes. Continue to keep that same calorie deficit. You're into your third week now. Did you lose weight? No. All right. As long as you're as long as you are consistent with that diet, that tells you your body has hit a level where it's not going to lose anymore. Reduce 150 calories. Dieting is not a race. If you treat it like one, you will fail. Consistency, willpower, dedication, motivation, whatever you want to call it. Dieting is not a race. It's a journey. Because if you treat it like a race, once you're done, if you get to the finish line, you will fail and bounce back because you are going to be so deprived of everything you enjoyed previous. If you take it slow, over even a year, you will adapt a routine, a new lifestyle where you can enjoy whole, delicious foods, a variety of them, and still enjoy that pizza, that beer, that glass of wine, that chocolate bar, whatever it is. Consistency, consistency, consistency. I'm going to say it again before I let you go. Consistency. I hope you enjoyed this. I didn't get to talk about the body too much. I went on a tangent about health and fitness. But by doing that, you can create a body that you're excited about. I look at myself week over week, and it's getting better and better and better. Do I want to go farther? Of course I do, but Am I happy with where I'm at now? Yes. Do I want to keep going? Yes. Always be trying to improve yourself. Doesn't have to be by 10% or 50%. Try and get yourself better 1% every day, because in 100 days, that's a 100% increase. If you can make yourself 1% better every day for a year, that's a 365% return on investment on you. That is incredible. I'll see you in the next video. Take care.